Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am joined by Janice Abbott, CEO at Atira Women's Resource Society, a women's anti-violence organization that, among many other programs and services, operates a community health center in Surrey, British Columbia. We will be exploring the important work they are doing as we honor December 6th, which was the National Day of Remembrance and Action on Violence Against Women, and work toward improving access to care and support for women across our nation. How are you doing today?
I'm good, thank you. How are you?
Wonderful, thank you. So to start off, please tell us more about Atira Women's Resource Society, where it's located, and the services and programs provided in the community that you serve.
Sure. So Atira is an organization located in the Lower Mainland of British Columbia. So we have programs and services in a number of the communities in the Lower Mainland, including Vancouver, Richmond, Burnaby, Surrey, Port Coquitlam. And we are primarily a women's anti-violence organization, and we manifest our mandate through a lot of housing, but also related support programs for women and children who've been impacted by violence.
That's amazing. I did see while on your website that you've been CEO for 30 years this year, which is amazing from my understanding. And during that time period, I was curious because the way that we've discussed gender and labels like a woman has evolved. Atira is accessible to anyone who identifies and lives full-time as a woman and who experiences gendered violence and misogyny, including trans, two-spirit, and intersex women, as well as those whose gender expression is femme. I'm curious if you can talk about the process evolving to this point and why Atira felt it was so important to be inclusionary.
Yeah, so honestly, there was no sort of great debate with respect to including transgender women in our services or programming. It was a decision we made in the sort of mid to late 90s. So it feels like it's just been the way it is for forever. And honestly, the decision was made because we felt like it was the right thing to do. There was no great debate, no real resistance within the organization, and no detailed analysis. It felt like the right thing to do. And so we made that decision back in the 90s.
That's wonderful. I was very I've worked with other organizations, not in necessarily this world, who, they discuss like the nuancing in the language, and it's so important to be so inclusionary. So I really appreciated that when I was doing my research about the community health center. Atira Women's Resource Society also offers, as I saw, various programs such as pet outreach, an outreach van, and also legal advocacy. Can you tell us how and why some of these different programs were added?
Sure. So most of our programs across time have been added because women, including staff and women and children who access our services, identified them as needs. So, it comes to the pet outreach is a really good example. Our programs are also all pet friendly. Our housing is all pet friendly. It wasn't back in 1992 when I started, but when we began to see women reluctant to leave home where there was violence occurring because they had no safe place for their pets, or having to give up their pets for a couple of weeks or months while they stayed in transition house, because we did have an arrangement with a local shelter that women could take their pets there, but pets are part of the family, and just across time, as in our desire to make our services as accessible as possible to women, the pet outreach program was developed. And it kind of is the same process for most. Legal advocacy, which we've been operating for about 20 years, again, it was women who were having difficulty finding a lawyer who understood their particular circumstances. And we do a lot of legal advocacy related to poverty law, but also custody and access, and also systemic change. So the disproportionate apprehension of Indigenous children, for example, we've partnered in suits against the various systems that make that happen. So it's really just listening to the women we serve, listening to our staff who are working on the front line and developing programs that address the gaps that are identified by women.
Absolutely. As you mentioned, so you highlighted some of the housing projects that you worked on. I'm going to list some of the wonderful projects that you have going on. And I will say that Atira is that you're a very unique community health center in terms of our membership. So, which is why I was really excited to have you a part of this. So, projects that you've worked on include the Pan Canadian Voice for Women's Housing, the 420 Hawks Avenue housing development to help women raise children together, enterprising women making art for women affected by violence to use art to overcome barriers, Canada's first upcycled shipping container housing development, the SNA 7A Transition House Society. Yes, perfect. And the YAYM digital storytelling for youth, some amazing innovative projects. Can you outline what some of these projects are and sort of how their conception came to be?
So just a corrections, it's SNAHA is the name of the new project in Chase. Again, it's identifying needs and gaps in services that women bring to our attention. We work with women every day. We're on the front lines. We're listening to them. We're talking to them. We are experiencing when we're trying to advocate or make referrals. We're experiencing those gaps in services, and we're frustrated when we can't find something that women need in order to sort of get themselves healthy, get themselves well, or create opportunities for them so they can do that. And so it's really just a process of actively listening to women, looking for other resources, and then working to develop resources where there are gaps.
Amazing. And in terms of, again, other resources like that, Atira also offers early care and learning centers and even hires women who reflect the clientele. Can you also tell our listeners like why it was important to incorporate hiring staff that, you know, represent the clients of Atira, and the impact that that program specifically has had on the community that uses it?
Sure. So again, back in the early to mid 90s, we made a decision that we would drop the requirement for a university degree to be eligible to apply for a job at Atira. We recognize that while there are many amazing women, skilled and amazing and passionate women who have university degrees, there are a lot who don't. But who have lived expertise, who bring the skills of their life experience to the workplace. And we really believe that we needed a combination of skills and experience on our staff in order to best serve the women who access services at Atira. So probably in about 1993, we changed our human resource policy to include women who brought lived expertise to the work. And why does that matter? Because it means we have women who understand what the women who are accessing services are going through because they've been there before themselves. Many women who have developed excellent skills based on their lived expertise, and who have accessed services before and know how to work the system. So yeah, it means when women come into the space, they see women who reflect themselves. So that includes women who speak different languages, women who look the same as they do, and it makes the space more comfortable and more accessible. We hope. We believe.
Of course.
That's why we continue to do it.
Yeah. So I was also really interested to see that Atira has several social enterprises, including property management, a coffee shop, and programs focusing on helping women create and sell their art as previously described. How has delving into that world of social enterprises contributed to the overall community health center model, and has impacted the community that you serve?
and I'm not sure how to connect them to the community health center. The community health center is one of Atira's programs, and as you probably know, it's a unique community health center among, I think, community health centers. It has a very specific and a very narrow mandate. I guess with respect to the social enterprises, because there's employment opportunities and income earning opportunities for women, the women who access the community health center are able to participate in those programs, like all of the women who access our programs and services. But I'm not sure there's a direct connection between the social enterprises and the community health center, except that it's I guess a basket of services that we're able, or opportunities that we're able to provide to women.
Sure. So I'll clarify that when I say community health center model, what I mean is that idea of like wraparound care and support. And so not just primary care as we might see it as a community health center in Ontario, where you're going to get vaccines or you see a therapist. But the fact that what I found interesting was, if you've got a coffee shop and property management and you're focusing on selling, or you're developing, as we've already discussed, like all of these resources help build, I assume, mental health fortitude and a sense of community and a sense of pride in self that to me would lend specifically to the idea of the model without being specifically directly linked to the building, the community health center. So that's what I was more curious about, was how it's impacting the personhood and their development and their, like zest for life, if you will, by having all of these different options and things that you've delved into. Because I don't know that we have another community health center in our membership that like has any relationship to a coffee shop specifically, other than maybe a partnership. So it's very, very cool.
Yeah, I again I'm sorry, I'm struggling. There's not a direct connection.
Okay.
So I'm struggling to respond to that connection, except in that all of the programs and services that we offer create opportunities for women if they choose to pursue them.
Yeah.
So everything is obviously women's choice. They pursue including the community health center, they pursue the various programs that make sense to them. I think that having these sort of basket of opportunities for women and for the community hopefully just create space for women to be able to make choices about where they're going.
What needs do you see within the community and clients that Atira Women's Resource Society serves that rely on investment from both provincial and federal governments, as well as health system decision makers, to improve the health and well-being of the clients and community?
So the first two words I didn't hear, so I heard the last.
Then what are the needs of that you see within the community and clients that are basically directly impacted by a federal and provincial investment?
Okay. So with respect to Maxine Wright Community Health Center, we started in about 2002 with two women that we had been working with who we met after they went to hospital. They had shown up at the hospital in Surrey to give birth without ever having seen a doctor. And in both of those cases, the reason they hadn't seen a doctor was because they had partners who refused to let them see a doctor for any prenatal care. So Maxine Wright sort of grew out of that experience, and we soon came to realize, doing some research, that there were about 120 women at that time who showed up at Surrey Memorial Hospital every year, having never had any prenatal care. Many of them because they had abusive partners, but not all. There were other reasons as well: mistrust of the healthcare system, language barriers. So Maxine Wright came about as a result of working with those women and recognizing that we needed a more community-friendly, community-accessible program that would make it easier for women to see doctors. And so Max Wright is more than, I don't know if it's more than just a community health center. I think all community health centers are unique in this way. But, in addition to providing prenatal health care, pre and postnatal health care to women, We also have a hot lunch program and a drop-in program. So for women who are, and a pregnancy outreach program. So for women who are in abusive relationships, the program can seem more benign to their partners. And we're also there working with women who are struggling with substance use and or mental wellness, and you know, which is often goes hand in hand with violence. So women who experience violence often use to cope with their situations, and they struggle with their mental wellness. So we wanted to make a center where we believed the abuser would seem more benign to the abuser, less threatening, and be able to provide the services that women need in order to, you know, birth the healthiest babies possible, and to keep themselves healthy through the pregnancy and postnatal periods.
And is there anything specifically at the Maxine Wright Center that you can think of that you wish that like increased investment for that specific community health center, or anything in Atira in general that, you know, extra funding would really, you know, benefit or allow you to expand or grow?
Well, we have at the Maxine Wright Community Health Center, at last count, we had almost 1,000 women and children on the client list. It's a 8,000 or 8,500 square foot community health center. We really need a sister community health center. We're really working hard at Maxine Wright to be able to stay connected with women and children until the kids are age 6. So we want to, which is when they go to school, so that there's eyes on or support for the family through that sort of early childhood period. And that's why we also have the daycare, early care and learning center at Maxine Wright, so that children can potentially, and we have housing there as well. So there's a shelter and second stage housing for women who are pregnant and early parenting. You know, when you start to have as many women or families on the client list as we do, then you have to start looking at making decisions like, do they stay attached until age 6, or do we have to cut them off at age 4 or age 2? And really what we need is a health center or a twin health center, so that we don't have to make those hard decisions.
Absolutely. I want to thank you so much, Janice, for your time today. And I'll just wrap up with one last question while my co-host, if you're watching this, is beside me. That's my pet, Maxwell. I'm just curious if there's anywhere, if anyone wanted to learn more about Atira Women's Resource Society, where they would go look, or a website if they wanted to learn about any of the amazing projects that we've discussed today.
Yeah, best places, as always, is our website. It's www.atira.bc.ca.
Wonderful. Thank you so much for your time today.
Thanks, Hillary. Bye.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.